I'll be illustrating or explaining the dexamethasone suppression test, which is a test that is commonly used in the diagnosis or assessment of Cushing syndrome. Cushing syndrome is a metabolic problem, an endocrine problem where there's excess amounts of cortisol in the body or in the blood. When a person has excess cortisol or Cushing syndrome, typically they could have, a high BMI, so they could be overweight or obese. They could have a fatty lump, what we call the buffalo lump, right there at the back. They could have high blood pressure, which is hypertension, type 2 diabetes. They could have, problems with the acid-base balance and electrolyte imbalances with sodium and potassium, and a litany or a wide range of other problems or complications or symptoms. So let's go straight into this dexamethasone suppression test. I'll be using this whiteboard to illustrate. There are two forms of the dexamethasone suppression test. We've got the low dose dexamethasone suppression test, as well as the high dose dexamethasone suppression test. So the low dose dexamethasone suppression test is used in the diagnosis to establish the diagnosis of Cushing syndrome in addition to the clinical features. Whereas the high dose dexamethasone suppression test will be used to localize, the cause or localize where the tumor or the lesion that is causing that Cushing syndrome is in the body. And I'll explain. Let's proceed. So we have the brain. Let's say this is the brain. We've got the brain. And we have a pair of adrenal glands. So we have your adrenal. Okay. So the brain, the anterior pituitary gland will produce ACTH, adrenocorticotropic hormone. Now the ACTH will stimulate both adrenal glands to produce cortisol. Okay, so the adrenal glands will produce cortisol. This is the physiology of cortisol production in the body. This is how cortisol is produced. Now what happens in Cushing syndrome is that you have an excess of cortisol. Now to establish that diagnosis, you would first of all start with the low dose dexamethasone suppression test. So how this is done is you give the person or the patient 1 milligram of cortisol, 1 milligram of dexamethasone. So 1 milligram of dexamethasone is a low dose of dexamethasone. Under normal circumstances, 1 milligram of dexamethasone should suppress ACTH coming from the pituitary. So if you give me 1 milligram of dexamethasone at 11 p.m. and you take my blood sample and check my ACTH level 8 to 9 a.m. the following day, my ACTH level would have been suppressed to be lower than normal, lower than expected. And because you suppress my ACTH, my cortisol level will be suppressed because you won't have enough ACTH stimulating the adrenal glands to produce cortisol. That's a normal response. Now, in a person who has Cushing's syndrome, because 1 milligram of dexamethasone is a small dose, it's not going to be large enough to suppress ACTH production. So someone who has Cushing syndrome, when you give 1 milligram dexamethasone at 11 p.m., you give it at 11 p.m., and you do a blood test at 8 to 9 a.m., the ACTH level, ACTH, would be unsuppressed. It will be raised. And the cortisol level will also be raised. That establishes the diagnosis of Cushing syndrome. Low dose dexamethasone suppression test. Okay, 1 milligram given at 11 p.m. You do your biochemistry, 8 to 9 a.m. ACTH level will be unsuppressed. It will be high or elevated. Cortisol level, consequently, will still be elevated. Okay. Now, the next question will be, you ask yourself, where is this lesion or problem coming from? Is it coming from the pituitary gland producing excessive ACTH? Is it probably coming from one or both adrenal glands producing excess cortisol? Or is it coming from what we call an ectopic site? For instance, from a lung cancer producing excess ACTH, what we call paraneoplastic, syndrome. So those are the three possibilities. So you want to find out where the lesion that is producing this excess cortisol is. That leads us to a high-dose dexamethasone suppression test. There are two ways of doing the high-dose dexamethasone suppression test. The first method, or the first way, is very similar to the low-dose dexamethasone suppression test. So if we move there, so the high dose, hope it's being seen. Let me see if I move my camera this way. Yeah, I think that's better, yeah? So the high dose DEXA, if we go to the high dose, what you could do at 11 p.m., you can give 8 milligram of DEXA. 8 milligram, which is a high dose, because 8 milligram is much higher than 1 milligram. Give 8 milligram of dexamethasone at 11 p.m. And then at 8 to 9 a.m. the following day, you do your blood test. Okay? This leads us to the interpretation. Now, let's understand it. You give 8 milligram, 11 p.m., do your blood test, and the blood test will be ACTH and cortisol. If the problem is from the pituitary gland, let's say the pituitary gland in the brain is producing excess ACTH, the 8 milligram of dexamethasone will suppress the dexamethasone will suppress the ACTH, because that's what glucocorticoids do. Negative feedback, they will suppress it. So the 8 milligram will suppress ACTH. So if it's coming from the pituitary, gland, you give a high dose. Remember, the low dose could not suppress it. The high dose is supposed to suppress it. So the 8 milligram, which is high dose, will suppress the pituitary. So ACTH will go down, and subsequently, because you won't have enough ACTH stimulating your adrenals, cortisol will also go down. Understood? Yeah. Now, if the problem is from the adrenal glands, let's say there's an adrenal hyperplasia or an adrenal adenoma, okay, a tumor of the adrenal gland, what's going to happen is, so if it's coming from the adrenal glands, the adrenal glands will be producing excess cortisol. Okay, so the adrenal glands are producing excess cortisol. So you don't have excess ACTH production from the pituitary when the problem is from the adrenal. So if you give a high dose of DEXA, you're going to suppress ACTH level will be suppressed. And cortisol level, the cortisol level will still be high. Okay, because why is cortisol level high? What drives cortisol is ACTH normally. But now you have an independent cortisol producing lesion. It could be adrenal hyperplasia or an adrenal adenoma producing excess cortisol being driven independently. Yeah, your high dose dexamethasone would normally suppress the ACTH from the pituitary, but it will not suppress that adenoma that is secreting excess cortisol. So your cortisol level will still be raised. Now let's look at the next one. If the ACTH is ectopic, so if there's an ectopic ACTH secretor, let's assume there's a tumor in the lung, a lung cancer, producing excess ACTH. What's going to happen is that when you give this high dose dexamethasone, the high dose dexamethasone will suppress ACTH from the pituitary, but it will not be able to suppress ACTH from that tumor, that ectopic tumor or ectopic secretor. So ACTH in the blood will still be high, because the test you're doing is not going to differentiate, doesn't have the power to differentiate ACTH from a tumor or ACTH from the pituitary. So ACTH level is going to be high when you do the blood test, because your DEXA, even though it's going to suppress the endogenous ACTH, within the brain, already the endogenous ACTH would have even been suppressed because the ACTH from the tumor would have been stimulating excess cortisol that would have had a negative feedback on the from the one within the pituitary. They are both endogenous, but one from the pituitary. So your ACTH, your high dose DEXA, 8 mg DEXA, will not suppress that. Now, because it doesn't suppress that ectopic ACTH is still stimulating the adrenal glands, cortisol will still be high despite your 8 mg. So from what we can see, that cortisol will only go down when you have ACTH coming from the pituitary. If it's coming from the adrenals, it will still be high, but ACTH should be suppressed. If it's ectopic, ACTH and cortisol will be high. So it's first of all understanding what happens to ACTH, and then working out what happens to cortisol. Now, this is one way of doing the high dose dexamethasone suppression. You can see that it is similar to the low dose dexamethasone suppression in the sense that you give it at 11 p.m. and you do your blood test at 8 to 9 a.m. There's a second way of doing this high dose dexamethasone suppression test. The second way, I wouldn't clean this, but I'll just put it in there. Okay, let's push my camera to show that side. Yeah. So if you look right there, I'll use that small space. The second way to go about your high dose dexamethasone suppression test is you give 2 mg of DEXA every 6 hours. So 6 hourly for 48 hours. Which means, what it means is that you're going to give a total of 16 mg in 48 hours. Okay, so every 6 hours, you give the person or the patient 2 mg of dexamethasone, and you did it for 48 hours. So in 48 hours, you would have given 60 mg, which is higher than the 8 mg. But because we are spreading it across, it's going to be, you need a higher dose eventually, a higher total dose. And then at the end of the 48 hours, you do your blood test, okay, where you check your ACTH and you check your cortisol. And then you do the interpretation. After checking your ACTH and cortisol, you do the interpretation this way. Exactly how so the first thing you have to check is you give your high dose of dexamethasone using either modality. Either you give it as a single 8 mg at 11 p.m. or you give it as 2 mg every 6 hours over 48 hours and check it. When you get your results, you look at your cortisol level and you look at your ACTH level and you compare them to the normal laboratory values or ranges. Depending on how it is, then you cannot interpret as to whether it's coming from the pituitary or coming from an ectopic site, ACTH secretor, or coming from the adrenals producing excess cortisol. That would then influence the imaging studies that you want to do, whether you want to do a CT or MRI scan of the head to look at your pituitary gland, or a CT or MRI scan of the abdomen to look at your adrenal glands, or what we call a CT tap thorax, abdomen, and pelvis to find the source of these ectopic ACTH secreting lesion, usually a tumor. So I believe I've been able to break down this topic in such a way that it's actually clear. Let me see if I flip this camera. Yeah, just so you can see exactly what I've done. Yeah, just for you to see it as a summary. Go through this video, watch it, and understand the difference between a low dose dexamethasone suppression test and a high dose dexamethasone suppression. And the most important is for you to understand the interpretation of these tests. So if you understand the motive, the principle behind each one of it, as well as understanding how to interpret it, that requires you to understand the physiology of ACTH and cortisol secretion positive, negative feedback. That way you can understand what happens when you give a low dose, what happens when you give a high dose, and you can interpret the result. I hope it's been very useful. I will enjoy you to like this video, subscribe to my channel if you haven't already subscribed, and hit on the notification bell so when I release further educational videos, it will pop up on your screen and you'll be able to watch and benefit from it. Cheers guys. Thank you for watching.